I want to assess my patient today. I want to assess his thorax and lungs. Before I start, I'm going to perform hand hygiene. I'm going to provide privacy for my patient by drawing the curtain. I'm using my patient, my 4-year-old son, and pretending he's an adult. I'm going to introduce myself to my patient and then check his name and date of birth by performing the two person identifier check. The two identifier check with him, have him verbalize his name and then check his wristband for his name and date of birth as well. And then I'm going to explain the procedure to my patient that I will be assessing his thorax and his lungs. So, and as I go ahead, I will be providing instruction for my patient as well. And I already have my equipment ready. I already cleaned my stethoscope. I gathered my equipment already. And so since my patient actually presented with pain, since my patient presented with pain when he's breathing, I'm going to assess for the qualities of the pain. I'm going to assess for the characteristic of the pain. So I'll be asking my patient for the onset of pain, when the pain started, the duration, and then I will be asking how often the pain is. I want to know the factors that actually make the pain worse and those things that makes it better. I want to know the quality of the pain. What does the pain feel like? Is it throbbing or dull? Is it stabbing? Then I want to actually check ask my patient if the pain is localized or it is radiating to other sides of the body. I want him to point to where it hurts most, and then I want to actually ask him to rate his pain, the intensity of the pain, rate the pain on the scale of 1 to 10. I want to know what the pain he has, and then I'll be asking for any treatment he has had, any medication he has had for the pain, what the side effect is, what the symptom is when it first started, and I want to check his understanding of the pain as well. If what did he think caused the pain, and is the pain affecting his activity of daily living? I want to know what his concern is about how he's feeling. Okay, so before I assess my patient as well, I'll be checking some factors. I want to ask him, I will be asking, do you smoke? Do you smoke? So for my patient, he actually said he doesn't smoke, but he usually have cigarettes once in a while. And then I want to ask if he has any cough. If he is,
I don't have cough.
Okay, so he doesn't have cough. My patient verbalized that he was stressed, and I want to be asking him if he has any allergy. Do you have any allergy?
No.
Okay, he said no, there's no allergy. And then did you use any over-the-counter drugs? So I want to be sure if he has used any over-the-counter drugs for pain. And then I want to ask him for his past medical history, if he's had any respiratory infection before. So my patient actually verbalized history of cold and asthma. And then I want to ask for any previous tests he has done before. So for my patient, he has had a tuberculin skin test done before. So proceeding on the test, I want to inspect my patient's thoracic cage. I want to look at it for symmetry. It's symmetric, it's the same on both sides. And then I want to check for the spinous process. It's midline and it is straight. It's midline. And then after that, I want to actually note the anterior posterior diameter. I want to note that it is actually lesser than the transverse diameter. And then looking at it for the at the normal ratio, which is ratio 1 to 2, it's actually okay. Then I want to actually have my patient sit down as I palpate the posterior part of the chest. So if he's an adult, I'll be placing my thumb on the 9th and 10th thoracic. So I'll be I'll be pinching. I'll slide my thumb medially and pinch up little bit fold of skin up between my thumbs, and then I want to actually confirm the symmetry and the chest expansion is the same on both sides by doing that. So after that, I want to actually palpate for the tactile firmators by putting my palm on the, so I will have my patient sit very well, and then I'll put my palm right on the up to make my thumb face the shoulder, to make my thumb face the shoulder, and then I'll palpate on both sides by having my patient to say 99. So can you say 99?
99.
So I want to actually palpate for the vibration of sound. Can you say 99?
99.
So I will do this on each point. Can you say 99?
99.
So I'll palpate on each point. Can you say 99?
99.
Good. Can you say 99?
99.
Good. Can you say 99?
99.
99?
99.
Good. 99?
99.
Good. 99?
99.
Good. So on each point I want to palpate and feel the vibration of sound as I move downward when I'm palpating. And then after palpating the back, I want to auscultate. After palpating, I want to percuss the lung field as well to check for the sounds.
My neck wants to rest.
Okay, just a little bit more, okay? Just few minutes. Okay, so I want to percuss and check for the lung field as well. So I'll be starting to check for the lung field, and then I'll be percussing, and then so after percussing the lung field, I want to be sure the sound heard are the same on both sides, and then I will want to auscultate both the posterior chest and the anterior chest for the breath sounds, and then I want to be sure both sides have the same sounds and the sounds are not abnormal. Breathe in, breathe out, breathe in, breathe out, breathe in, breathe out, breathe in, breathe out. Breathe in, breathe out. Breathe in, breathe out. In, out. Okay, so I'll be turning you forward now. Okay, so on the anterior chest, if I'm checking For the chest wall, I want to check the bronchial side. I want to check the bronchial vascular, and then I want to check the vascular for the chest wall, and then I want to actually check for the adventitious sound. I want to be sure there's no abnormal sound, so I will be wanting you to breathe in, breathe out. Okay, so just sit very well for 1 minute. Breathe in, breathe out. Okay, breathe in, breathe out. Breathe in, breathe out. Okay, so the sound is normal, and then there's no abnormal sound. And then when I was checking the posterior chest and the anterior chest, there's no lesion, there's no cyanosis, there's no pallor. The skin condition is okay, the skin color is okay. And then when I was checking, when I was looking at him, and I assessed the neck and all, like the neck muscles are well developed, and the neck muscles are well developed, and the trapezius is well developed as well. So there's no abnormal sound. If I'm going to have a nursing diagnosis for my patient, I will be diagnosing him for risk for impaired gas exchange, which is related to shortness of breath, because my patient actually came in with shortness of breath and then pain when breathing. So I will be diagnosing for risk for impaired gas exchange related to shortness of breath. So after assessing my patient, I will explain my findings to I will be documenting my findings later and asking for any concern. And when I'm going through the assessment, I will always remember to tell my patient that I just need to check each point on his posterior chest and each point on his anterior chest, not because there's something abnormal, but because it is actually the normal assessment procedure. And then after the procedure, I'm going to perform hand hygiene, make my patient comfortable, and then I will be documenting my findings appropriately. And then I'll clean the equipment and disinfect everything that I have used. Thank you.